This is Chiropractic Solutions with your host, Dr. Christopher Newble from NuHealth Chiropractic in Summerville, South Carolina. Hi, everybody. In our past couple of sessions, we've looked at migraine headaches. We've taken a look at the anatomy of a migraine headache and how it forms. We've also taken a look at some of the popular drug therapies for migraine headache symptoms that really just address the symptoms and not the cause of the migraine headache. But as promised, I'm going to tell you what causes a migraine headache. It's very simple. It's a couple of different folds, and it's not hard to figure out. It's blood flow to the brain. It's a problem with blood circulation. Now, what aids circulation in the body? Well, they're called baroreceptors. They're things that measure pressure in the blood vessels in the body. And they're located in a couple of different places. One of those places is right here in the aortic arch, right above the heart. But another place is in the neck, in the carotid sinus. And the chiropractic adjustment has been absolutely, positively proven to relieve stress to this area and improve blood flow to the brain and hence reduce the number and severity of migraine headaches. Now, what are your options for headache treatment? Well, people who seek treatment for headaches should start with their chiropractor. The overwhelming majority of patients can be managed in primary care settings. Most don't need neurologists or headache specialists. It's relatively easy and simple to diagnose and treat most headaches, but it's not always easy to tell what causes a headache. Now, your medical doctor may not have the time or training to delve deeply into it. Your chiropractor does. Chiropractors have been specifically trained in how to diagnose and treat headaches. And after completion of a treatment plan with your chiropractor, you may drastically reduce or eliminate your use of medications, which is something we all want to do. Now, some of the things that can trigger migraines have to do with your environment. They can do with the weather, your intake of red wine, caffeine, cheeses, or chocolate. Those can all be headache triggers. Changes in your sleep habits. Stress can be a trigger. Glaring or flickering light can be a trigger. And also hormonal changes can also be a big migraine trigger. Now, how do you determine what a trigger is? Well, you have to keep a diary. And this is what your chiropractor should do with you if you're going into them for migraine treatment. You got to keep a diary of your habits and symptoms for at least a month. Now, be sure to note the following in your diary: the date and time each headache started, the date and time each headache ended, how long was the attack, were there any other factors that seemed to trigger the headache, smoke, bright lights, stress, were you tired that day, were you active that day, were you inactive that day, what did you eat that day? Even hours or minutes before the headache attack, this can be a big clue as to what's triggering the headaches. Did you work late that day? Did you oversleep? Did you undersleep? Did anything remarkable or unusual occur just before the headache attack? And we also need to know the location and nature of the pain. That is, was it on one side of the head? Was it on both sides of the head? And what's the pain throbbing, aching, stabbing, dull? And also tell us the severity of the pain. There can be other physical symptoms too. We need to know, were you nauseous? Were you vomiting? Did you have any visual disturbances? Any sensitivity to light or sensitivity to noise? Was that sensitivity mild or severe? Now, if you're a woman, we also need to know the date of your last menstrual cycle. When did the period start? When did it end? Do you take birth control pills? If you do you think there's any connection between birth control pills and the headache? If you're on hormone replacement therapy, is there any connection between your HRT and your headache? You'll see a migraine pattern that's connected to your eating and other events in your life. Now, once you identify the substance or episode that causes your headache, you must avoid it if you possibly can. How does chiropractic help? Well, as discussed before, the chiropractic adjustment has been absolutely positively proven to relieve stressors to the baroreceptors in the neck that regulate blood flow to the brain. The chiropractic adjustment also relieves stresses right inside the neck with the bones and the muscles in the neck and the upper back that put stressors on these baroreceptors. Doing that helps regulate the blood flow to the brain and reduces or eliminates your migraine headaches. Now, headaches can, of course, result from many different conditions, but research has revealed that a common cause, often unrecognized, can be traced to the cervical vertebrae, that's the spinal bones in the neck. Seeking relief by merely drugging the pain often allows the cause of the symptoms to go untreated. If you have headaches, it would be wise to seek qualified professional counsel as early as possible from a doctor of chiropractic. Now, what are your treatment options? We're going to talk about lifestyle adjustments. We're talking about doing things to adjust your diet. A little bit of exercise, maybe 20 minutes a day, will also help decrease your migraine headaches. Forming a regular sleep pattern, and also chiropractic adjustments to relieve tension to the neck and upper back, improve blood flow, and treat the neurological causes of migraine headache. And what can you do? Well, you can limit consumption of red wine, cheeses, and chocolate. Stay hydrated. It's really important to drink plenty of water. Exercise daily, a minimum of 20 to 30 minutes a day. Remove aggravating factors and activities from your daily life. Sleep, get as much of it as you can, a minimum of 7 hours a night. 8's a little bit better. And I'll give you a little hint too. Falling asleep before midnight helps maximize your body's growth hormone levels. Now that I've shown you how chiropractic care can help you reduce or eliminate migraine headaches, next time on Chiropractic Solutions, I'm going to show you some of the great research that's going on that shows how chiropractic care helps migraine sufferers. We'll do that all on our next installment of Chiropractic Solutions with me, Dr. Christopher Newell from NuHealth Chiropractic in Summerville, South Carolina. Area code 843-821-6570. See you next time on Chiropractic Solutions.